Good afternoon, everyone. Welcome to the weekly Joint Task Force briefing on COVID-19. I'm Doug McGowen, representing the Joint Task Force of Memphis and Shelby County, joined today by Dr. Taylor from the Shelby County Health Department. We also have representatives from the Mexican Consul in Little Rock who will have some words for us today. I'm going to talk just a bit about hospitalizations, vaccinations, and testing, and then I'll turn it over to Dr. Taylor for data on the course of the pandemic. Unfortunately, we have reached yet another high watermark for hospitalizations in our community. We have 721 people hospitalized today, 518 people in acute care, and 203 people in ICU level of care, and also the highest level of people that have needed to be intubated at 163. We still have about 6% of our acute care bed capacity available and about 4% of our ICU bed capacity available, but that is filling up rapidly, and hospitals are still experiencing staffing challenges, and we are working together, as we talked about last week, to try to address some of those issues. As high water as the number of patients is this week, we have reached another milestone, however, with our vaccination. As of this morning, we have surpassed 50% of the population that has received at least one vaccination and 40% that have received a full course of vaccination of 2 or more. We are encouraged that we are seeing some uptick in vaccinations. We are preparing for what we know will be a surge when booster vaccinations are ultimately approved. Again, we anticipate that happening sometime in September. It's not just through our public pods or at places where people can access vaccinations at the private clinics, the pharmacies, and the hospitals, but our healthcare navigator team has done substantial work in the community, vaccinating more than 10,500 people. That's 7,500 people at community-based pods. Those are at churches and businesses and organizations. There are 2,600 people who are homebound. We have visited them in their homes and given them vaccinations in their homes, and more than 400 people who are experiencing homelessness have also been vaccinated by our healthcare navigator team. You'll see just a minute the graphic for vaccinations. We have done in the month of August more than 6,000 vaccinations at our public pods. Importantly, that includes more than 500 vaccinations that would be considered a third dose for people who are immunocompromised. As you know, we have recently received clearance to give a booster dose to people who do have some type of immune issue, and so people are taking us up on that at our public pods. And again, we'll have more information when boosters are actually approved for the rest of the population. Testing continues to be an issue that we want people to be aware of. If you need to get a test because you're symptomatic, we want you to go to COVID-19 at memphistn.gov and find out where you can get that test. We are increasing capacity at our testing sites. We have added additional lanes at Poplar Healthcare out on Hacks Cross. We have added an additional lane on the RKS Commercial Cove, that's the Lamar Inspection Station. And we've actually added a new site in partnership with Christ Community Health Services and the Shelby County Health Department at 3362 3rd Street. That is the Christ Community Clinic there. It's open Monday, Tuesday, and Friday from 9 a.m. to 5 p.m. and it's open on Saturdays from 10 to 2 p.m. So another high volume drive-through testing site. Again, if none of those sites work for you, go to covid19.memphistn.gov. We update that regularly so that there's accurate information where you can go get a test. I talked a little bit about our door-to-door campaign. Just in August alone, we knocked on more than 7,000 doors, and that resulted in more than 150 people getting a vaccine on demand. The Vaccine on Demand program has come to a close, but through the month of September, we will continue our door-to-door campaign, getting information out to people in zip codes who have the lowest uptake of vaccinations. And another report on our phone banking, again, calling people to give them information and helping them to get over vaccine hesitancy. Since June, when we started this, we've called more than 72,000 households, and we've had extended conversations with more than 10,000 households about how we can provide resources like testing and vaccination to those homes. And we're going to continue that all the way through the end of September. in hopes that we can get more people vaccinated and to encourage people to get tested. And so now I'll turn it over to Dr. Taylor, who will provide us more data about the status of the pandemic.
Good afternoon, everyone. New cases reported today in Shelby County, 531. There are an identified 8,552 active cases, meaning that is within the last 14 days. It is estimated that for every identified case, about another 2.5 are not identified. The effective reproduction number is now 1.1. You'll note that that's a bit lower than it has been, but it is still above 1, meaning that transmission is still faster than we would like. Total pediatric cases as of today, 20,209 to date, with new pediatric cases reported today, 175. The percent of active pediatric cases of the total active cases is almost 40% at 38.2%. Total COVID-19 hospitalizations and acute care beds have been reported by Chief McGowen. 49.7% of the total population has received at least one dose. 39.8% of the total population is fully vaccinated, meaning they've had their complete series. Zip code with the highest vaccination rate remains 38138 and 38139 together at 73%, and the zip code with the lowest vaccination rate to date is 38127 at 33.3%. The Delta variant represents 98% of active sequence cases in Shelby County. And now I'll go through a few slides. On slide 1, you'll see that our new reported cases are at 531 today, and our new pediatric cases are at 175. On the next slide, you will note that pediatric cases continue to outpace other age groups in the county. On the next slide, you will see the active pediatric cases by zip code, with the darker areas representing more cases and the lighter areas representing less cases. On the next slide, you will see a comparison of the number of active cases by zip code in the county compared to the percent of vaccinated individuals in our county by zip code. And on the last slide, you will see that our residents who have completed the vaccination series sits at 39.8% of the population, and 49.7% of our Shelby County population has received at least one dose. And now we have a special guest joining us today to address a population group that is a very important part of Shelby County's COVID-19 vaccination campaign, the Latinx population. While nearly 28,000 people who identify as Hispanic or Latinx have been vaccinated in Shelby County, that is only about 6% of the estimated Latinx population in our county. That is why we are welcoming Rodolfo Arenas, Cónsul of Mexico, who traveled today from the consulate in Little Rock. He is here to speak directly to people in the Shelby County Latinx community in Spanish.
Muchas gracias, doctora Taylor. Thank you for having me. Muy buenas tardes a todos ustedes. Esta es la segunda ocasión que me encuentro aquí para hacer un llamado, una exhortación, una invitación a toda la comunidad hispana para que valoren los méritos de la vacuna contra el COVID-19 y contra la variante Delta. Agradezco al Departamento de Salud del Condado Shelby, al alcalde Lee Harris, por todos los esfuerzos que realizan para lograr disminuir los contagios y evitar la muerte de muchas personas. Al personal médico en particular y a todos los que trabajan en clínicas y hospitales, muy reconocidos y muy agradecidos por todos sus esfuerzos. A los medios de comunicación, tanto en idioma inglés como en español, a la prensa latina, a Sidney Mendelssohn, a Vivian, a Jairo, a Rafael y a Carla por su compromiso diario con toda la comunidad. A la doctora Michelle Taylor, welcome to the Department of the Health, doctora. A John Kerr, a Chief Washington, por su deseo de unir esfuerzos con el Consulado de México y trabajar juntos por el bien de toda la comunidad. Hay que aprovechar los beneficios de las 3 vacunas que tiene disponibles el Departamento de Salud, que son la vacuna Pfizer, la vacuna Moderna y Johnson & Johnson. Queridos amigos, comunidad latina, comunidad hispana, las vacunas contra COVID-19 y la variante Delta son seguras, eficaces, convenientes, salvan vidas y son gratuitas. No tienen que pagar un solo penny para poder vacunarse. Las autoridades migratorias, las autoridades federales de este país, han expresado que estamos frente a un reto mayúsculo, a una pandemia, y que por lo tanto, si ustedes deciden ir a vacunarse, nadie les va a preguntar sobre su estatus migratorio. Nadie les va a decir si tienen papeles o no tienen papeles. A nadie le va a importar si eres indocumentado, o mejor dicho, en el lenguaje de la administración del presidente Joe Biden, no ciudadano, para poder tener acceso a la vacuna. Vacúnense, queridas amigos y amigos. Háganlo por ustedes mismos, háganlo por sus seres queridos, por la comunidad en donde viven y trabajan. Vacunen a sus hijos menores, mayores de 12 años, ya la vacuna está disponible para todos ellos. Protéjanlos. Pero la vacuna, y ustedes lo saben bien, queridos amigos, no es suficiente mientras sigamos viviendo esta circunstancia de la pandemia. Tenemos que continuar con las recomendaciones y los protocolos sanitarios que nos imponen los médicos y las autoridades locales. Debemos seguir usando el cubrebocas, la mascarilla. Tenemos que continuar lavándonos las manos frecuentemente, utilizar gel antibacterial o toallas húmedas. Es importante que no acudan a lugares concurridos, no acudan a lugares cerrados. La pandemia, el virus, fluctúa por todas partes. Si van de compras, señoras, háganlo en una hora en que no haya público. Acudan a hacer sus compras o acudan a los establecimientos que tienen que ir a la hora de la mañana, temprano, o a la hora en la tarde, en la noche, cuando van a cerrar. Nunca compren en horas pico. Es muy riesgoso para ustedes y para sus familias. Y por favor, comunidad hispana, comunidad latina, recuerden, hay que proteger a los más vulnerables, que son los niños y las personas adultas. No lo olviden, las vacunas salvan vidas y cada vez que tengan alguna duda o algún comentario, acudan al Departamento de Salud del Condado Shelby o al Consulado de México en Little Rock. Muchas gracias.
Thank you, Quilantán-Arenas. We will open it up for questions.
Fred Broders, Local 24.
Thanks. Good afternoon, Dr. Taylor. Quick question, kind of following up with your message about the trends with pediatric cases. What message would you just like to reinforce to parents out there of ways to keep their children safe, especially those under the age of 12?
Great question. I have been saying this all along. Chief McGowen has been saying this. Everyone who is in this arena has been saying this. Please make sure that you know that everything adults do right now is so very important. So the first thing to do to protect your children is to make sure they're masked up. We know that they're already masked up in school, but even when you are out in public spaces where social distancing isn't possible, or you just want to be extra cautious, they should be in their masks, and so should you. We know that children can not only get this virus, but they can transmit this virus. And it looks a lot different with the Delta variant. So right now, we're telling people the old days are gone from the beginning of the pandemic, where you may have somebody who was a case. You may even have your child who was a case who was asymptomatic. And as long as they were isolating, it may not pass on to the rest of the family members. We know that Delta variant is more contagious, and as such, we know that children can bring it home and they can infect other people in the household. So it's so very important for everybody to be masked up. The other thing that's very important is that anybody who is eligible for the vaccination, anyone who is 12 years of age or older, should be vaccinated. If you have not been vaccinated by now and you're eligible, you need to go today to get that vaccine. We are going into a long weekend. We want to be able to enjoy our family members and our friends, and so we need to make sure that we are masked up. And if we have not been vaccinated, we need to make sure we are getting vaccinated in Shelby County.
Was there a follow-up?
Thanks, Dr. Taylor. And as a follow-up, I know a story yesterday my coworker did. There's some districts that provide on-site testing and some districts do not. Is there any efforts by the health department to potentially ramp up testing in school districts?
Great question. So a lot of our school partners, if they are not already doing testing, are planning on doing testing. There is no plan for us to mandate that in schools, but we are highly recommending that school districts, given their funding model and everything that they have to consider doing that. When you test in schools on a frequent basis, on a regular basis, school districts have an opportunity to really know what's going on in those schools, to identify cases of COVID-19 early, and to isolate those children and to quarantine their close contacts. So we are highly recommending that school districts consider this type of model, and we know that some of our larger school districts are already doing that.
Sam Hardiman, Commercial Appeal.
Hi, thank you for taking the time today. My first question, I'll have a follow-up, is to Dr. Taylor or Doug. Are you encouraged that hospitalizations only grew, COVID-19 hospitalizations only grew by 21 people in the past week compared to the rate of growth we've seen over the past several months?
Great question, and I will answer the first part and then I'll throw it to Chief McGowen. We are cautiously optimistic, but we also understand with any numbers that you hear, we always want you to look at the 7-day rolling average over the day-to-day number, because the 7-day rolling average gives you a better picture. And the other thing to understand is that testing demand has gone up, vaccination demand has modestly gone up, and so the folks who give us the results of those tests have to try to keep up with demand. So that's why when you see day to day, sometimes you'll see a very high number, other times you may see a lower number. So we're cautiously optimistic, but we also understand that going into the long weekend, we still need people to be extra cautious. Our hospitals are still strained. They are still holding a lot of people in the emergency room that they can't put up into rooms. And so we're cautiously optimistic, we're watching the numbers, but we also want the public to remain cautious, and I'll let Chief finish that answer.
Well, it's definitely a good question, Sam, and we are encouraged that the numbers haven't gone up dramatically, but neither has our average daily case rate. As Dr. Taylor talked about, the 7-day rolling average is still in the 700s. And as you know, it takes a week or two after that number starts coming down that we would expect our hospitalizations to start coming down. So Dr. Taylor mentioned that we are stressed in the hospitals. That number is very high. Our healthcare workers are having to work very hard. Our hospitals are having to manage bed by bed and patient by patient. And so until that daily case rate starts coming down, that average 7-day daily case rate starts coming down, we would expect our hospitalizations to come down about 2 weeks after that. So for at least the next 2 weeks, our hospitalizations are going to be relatively high compared to where they have been in the past at this new high level.
And my follow-up is just a real quick housekeeping question. Dr. Taylor, you cited a transmission number or not of 1.1 COVID Act now.
is showing 1.03. Where's the 1.1 coming from?
Great question, and I'm glad that you pay so close attention to the numbers. The 1.1 is coming from my team and what they are getting from all of the data sources that they use to compile the data. If it's showing 1.03, I can go back to them and see if that's compiled into the 1.1 and get you a follow-up answer.
Dominique Dillon, Fox 13.
Good afternoon. I have a quick question about children hospitalized. Could you share just how many are hospitalized and how many are on ventilators?
Great question. I do not know how many are on ventilators, but right now I believe the pediatric hospitalized number is 28, and there are 7 in the ICU.
And as a follow-up, I know we have some pretty big events coming up, Tiger football game, Southern Heritage Classic, etc. What message does that send to the public when you guys are trying to get things under control and then we have these big events? And also, how are you guys working to, keep the numbers down from what these events could cause?
Great question. So I'm not quite sure what message it would send to the public. What I hope it's sending is that we continue to have the same message, that you should be masking up when you are in indoor public spaces, and you should also be masking up when you are in outdoor spaces that are crowded and you cannot safely socially distance. I've said this before, I'll say it again. We depend on everybody in the community to do their part. We can put out rules and regulations and do as much as we can, but we also depend on our Shelby County residents to use some good common sense practices to protect themselves, their families, and their community members. It's so very important to mask up, and I know that a lot of the folks who put on these large events are very cognizant of that. They understand the importance. They will be pushing that message as well, and they have been pushing that message. They, as much as we, want to get back to some semblance of a new normal, and part of that is making sure folks are masked up, making sure we get the vaccination message out, and making sure we're reminding people that we're doing this not only for ourselves, not only for the adults in the community, but we're really doing this for the kids in our community.
Jane Roberts, Daily Memphian.
Oh, Dr. Taylor and Doug, I don't know which, but the New York Times tracker shows that both Tennessee and its children have the highest number of cases per 100,000. I wonder if you could give us a little color on how Shelby County compares to the statewide numbers.
So right now, what I can tell you is that that number hovering around 38 to 40% of active cases being pediatric cases is reflected across the state. We are aware of that. We know that over the last couple of weeks, that percentage has gone up. And so that's the message that you've been hearing from us over and over again. In addition to the hospitalization message, the message out of the emergency departments, we're also saying that the masking that we have done in schools is a direct result of seeing that possibly that RT number start to come down a little bit. The masking that we've asked to be done in indoor public spaces, we can see that that rate may be slowing down a little bit. But remember, the rate, anything above 1 on that RT number is still concerning. It still means that we are accelerating in our transmission rate. And the reason why we're asking people to stay masked up as much as possible is so that we can continue to stay the course. It is very concerning that we have those increasing percentages in the pediatric population, and we're doing everything possible to get the message out that we can get this under control, but we need everyone's help.
Thank you.
Kelly Roberts, WMC.
Hey there. Staying on the pediatric case topic, I'm wondering if you can kind of give us the reality of where these numbers are going, just the trends that you've seen, and if it continues this way, what it will look like. I know about 175 of the 500 some new cases reported today are pediatric? I mean, are we eventually going to see a majority of the daily cases, if the trends continue like they are, be pediatric cases? Right now they're at 40% of active cases. Are we going to see a vast majority of them eventually become pediatric cases? Is this pandemic shifting to be, one that is affecting kids?
Well, I'm not prepared to say that yet, and I'll tell you why. So right now what we're seeing is, yes, we're seeing almost 40% of our active case rate being in children. But the other thing that we're seeing is that the majority of our COVID-19 cases that are hospitalized are in our younger age groups, in those age groups 20s, 30s, and 40s. And I think I've made this point before. A lot of those folks that you see that are getting infected, that are unvaccinated, are the parents of these children. So it's one of those situations where it's hard to quantify. Are the children getting it first and passing it on to their parents, or are the parents getting it first and passing it on to the kids? No matter what the situation is, we do know that this continues to be a surge of the unvaccinated. And it's so very important that the folks who are eligible to be vaccinated, 12 years of age and over, get vaccinated. This will slow down the transmission rate. It will cause some relief in our hospitals, and it will also protect our children, add that extra layer of protection to the children under the age of 12 who cannot get vaccinated.
Thank you. And my follow-up question, I think, Chief McGowen, wondering if you can answer this. On Friday, Mayor Strickland sent out in his newsletter the need for filling some vacancies when it comes to some city services, MATA, trash, those sort of services. I'm wondering if, like in some of the surrounding Mid-South counties and towns that we've seen, if COVID transmission is either a threat to delaying some city services, if there is transmission among the short staff that is already in those departments, or if you've already seen any sort of COVID transmission affect the city services. Thanks.
Well, it's a good question. It's a bit of two different issues. Number one, there's just a general labor shortage across the country and here locally as well. We did see some impacts with COVID early on. We had some solid waste service interruptions early in the pandemic. That has largely not been the case since then. But it really is two different things. We do have very real vacancies that we are trying to fill. And those are actual vacancies. Those are people that are not on the payroll today. But it's not because we have people out of work because of COVID. These are just natural attrition. There is some turnover. A lot of those jobs are our part-time people who work seasonally, and we just weren't able to fill those roles. So no expected service disruption at this point because of COVID within the city of Memphis, and I don't believe also in Shelby County. There are some day-to-day impacts, but those numbers are relatively small. I'll let you know if that changes, but there is an opportunity for people who would like to come to work for the city in many of those roles available for people today.
Are there any closing messages today?
So I think you heard Dr. Taylor repeat it. Again, our hospitals are at a critical juncture. We are thankful that the number has not accelerated rapidly, but we also don't expect those hospitalizations to come down anytime soon until our case rate begins to come down. Our R0 has slowly gone from where it was almost at 1.4 down to just above 1 now, but it is still above 1, meaning we are growing the pandemic. We need to get it below 1 before we can actually begin to shrink the pandemic again. Masks are important. They are required at indoor settings. They are strongly encouraged at outdoor settings. And we'll let you know if that guidance changes. There's a new health directive coming out, and at some point if that guidance changes, we'll let you know. Vaccinations are plentiful, they're available, and they are free. So come on out and get one of those vaccinations. And we're asking everybody that you just do the right thing. We understand how this has been a rough 18 months for everyone in our nation. but it is not the job of city government, nor county government, nor the health department to navigate this alone, nor is it the responsibility of the hospitals to navigate this alone and to just be the net receiver of people who are very sick. It is individual by individual, person by person, who complies with common sense and doing the right thing that will get us through this pandemic. So I would ask all of us to look at ourselves and to make sure that we are doing everything we can to protect the people around us and to protect our entire community. Thank you.
Thanks, everyone. Have a safe holiday weekend, and we'll see you back here next week.